Hello everyone, I am urologist Omar Erdamakaya. Today we are going to talk about whether heart patients can use testosterone therapy. There were important question marks about this until last year. As a result, it is an important issue whether heart patients can use testosterone therapy or not. There are many heart patients around us. Patients who have undergone bypass, angioplasty, stenting after angioplasty are quite many. And they are taking many medications for heart disease. And these patients usually have low testosterone levels. They have erectile dysfunction, their mobility decreases. Especially a significant proportion of patients who have bypass, 1 in 3 of them get depressed. Because these patients have to restrict their own lives. These patients were studied and this study was completed last year. Why was this study done? In 2014, the FDA put a black box on the use of testosterone in heart patients. In other words, it put a question mark. Since it wanted more studies to be done on this subject and this subject to be clarified, studies on this subject started to be done. A study finally came to light last year. About 5,000 patients are taken. They are all heart patients. Half of these 5,000 patients were given testosterone treatment in the form of gel and the other half were given placebo gel. They followed these 5,000 patients for 2 years. It was determined that there was no difference in terms of cardiovascular problems between the groups of these heart patients who received testosterone gel treatment and those who received placebo. This is a very important thing, friends. So heart patients can also use testosterone. But in patients with advanced heart disease, that is, those who cannot climb 2 flights of stairs, who are out of breath when they move a little, in patients with severely weak pumping power of the heart, edema and blisters in the lungs, testosterone therapy is not applied. But other than that, heart patients can receive testosterone therapy. And when cardiac patients and other patients receive testosterone therapy, there is a decrease in intra-abdominal fat, better muscle preservation, increase in fat burning, increase in mobility, and more enjoyment of life. The patient's quality of life improves and his level of well-being increases. So in conclusion, I would like to say that heart patients can also receive testosterone therapy under control, within physiological limits, in the 600 to 1000 levels. Thank you for listening, best regards.